Welcome to Resolve It in 30. We're glad that you're here for this session. Just want to remind everyone that if you have any questions, you can use the chat application box that you'll see at the bottom of your screen that Zoom provides. And our moderator will be able to see your questions and raise those questions during the presentation. So let's get started. Without further ado, let me introduce you to your moderator for today, the Chamber's President and CEO, Jennifer Rodriguez. Jennifer?
Well, good afternoon to everybody. Welcome to Resolve It in 30. This is where we say that you give us 30 minutes and we give you the answers to all your pressing business questions. We are really glad to be here with you today. Once again, remember to mute your microphone and use the chat box if you have any questions, and we will be asking those of our guests today. The agenda is we'll make introductions, we'll enter into the content, have the Q&A, and we will provide any technical assistance and continue with additional questions that may come through the audience. We would like to welcome today Zachary Sherman. He is the Executive Director of the Pennsylvania Health Insurance Exchange Authority, or Pennie. We're going to have a very important discussion today around affordable health care in our community and the program that is becoming available to Pennsylvanians. What we know is that affordable health care is the #1 concern of small businesses around the country, and certainly amongst our membership. Providing affordability health care to employees is a major concern of business owners, and I think Zachary has a great alternatives for us today. So Zachary, why don't you tell us a little bit about yourself, a little bit about Pennie, and you can just really get started in the conversation, in the presentation that you have for us today. Welcome.
Thanks so much, Jennifer, and thanks to the whole organization and for the opportunity to be here. I will say I love this concept, the Resolve It in 30, the idea of getting through an issue, answering questions quickly. It's such a great concept, particularly in this environment. So I love it, and thanks for being able to be a part of it. As you mentioned, my name is Zach Sherman. I'm the Executive Director of Pennie, Pennsylvania's new health insurance marketplace. And I'm going to tell you a little bit about who we are, what we're going to do for the Commonwealth, what our timeline is, how you can access it. And so, jumping right into it, Pennie is derived from who we are and what we do. We're the Pennsylvania Insurance Exchange. It's P-E-N-N-I-E. It's intended to, particularly in the environment that is insurance, it's intended to be approachable, personable, a comforting place to go and access who we are, what we offer. Our overarching goal is to improve the accessibility and affordability of individual market health coverage for Pennsylvanians. That's primarily for those who don't access coverage through their employer, or who do not access coverage through public assistance, through medical assistance, or CHIP through government assistance programs. We will, starting this fall, be the official health insurance marketplace for Pennsylvania. The Commonwealth is transitioning from the federal marketplace, healthcare.gov, where currently 300,000 Pennsylvanians currently access this coverage. We're transitioning to the new state platform, the new state program, Pennie, which we will operate and launch this fall. It will be the home for high quality and affordable health insurance, commercial health insurance plans, and it will be the only source for the financial assistance that we provide to help reduce the costs of monthly premiums, and in some cases to reduce the cost of cost sharing, your deductible, your copay, your co-insurance.
So Zach,
go ahead.
So for example, a lot of small businesses, because of their financial situation, they're not really in a position to provide healthcare program,
right.
Or
yep.
So this is really important, because what you can do as a business owner is really educate and provide education and information about this program that your employees might be might be eligible for, right? So it's in a way in which, while the business itself does not provide or may not be able to provide healthcare to its employees, it definitely can encourage the employees to take advantage of the marketplace. Is that correct?
That's absolutely correct, and that's right. That sums up perfectly what we offer and what we offer broadly for individuals and families, and also employers in the situation you just described. And the financial assistance here is really key. And to give you an example, if you are an individual making in between $12,000 a year and up to like $48,000 a year, we will provide financial assistance to help make your premiums more affordable. And on the lower end of that, we'll also help pay for your copays and your deductibles. So in exactly that scenario, if you have an employer who has individuals who work for them who don't have access through that employer, the education piece is so key, because there's financial assistance to help pay for that coverage. And a lot of people are eligible who just may not know that's the case. So your point is spot on. Education through the place of business is really, really key here. So just real quickly on who we help. We have, as I mentioned, a bunch of about 300,000 people currently on healthcare.gov. We will serve them and assist them in the transition over to this new platform and program. Broadly, individuals and families without access to employer-sponsored coverage. I think this group of people is even more key right now with the economic impact of COVID-19 on the workforce. I think we're seeing a lot of people in reduced hours or losing jobs or on furlough. This is a really good and important alternative to COBRA. COBRA works for some, but there could be a situation where someone has access to COBRA and they have to pay full price, or they can have a very reduced price plan available through us. So it's a good alternative to that option. Obviously, we're very interested in trying to find the uninsured and make them aware of their potential eligibility for low or even free health coverage. And also, we play a role in partnering with the Department of Human Services to facilitate a no wrong door approach to coverage. So if someone comes to us and is eligible for medical assistance or CHIP, we can help facilitate that process of getting them into that program. We do that through a number of different enrollment channels. We will have a call center. We will have, obviously, online self-service. We'll have a website and online application. We will do direct outreach and education in the communities across the Commonwealth. And we will partner with health centers and other nonprofits to provide in-person assistance for people who want a helping hand to navigate through the enrollment process.
And Zach, one of the things that we have become incredibly aware in this period is, number one, really the disparity in health access that Hispanics have. Have you found that that there's the Latinos or Hispanics are not participating in these programs that are available at the rate that we would expect or want them to be?
Yeah, I think that's exactly right. I think that we have seen by looking at the data that we have available to us about those that are uninsured, we have definitely identified that there's a disproportionate share of the uninsured in the Hispanic community across the Commonwealth and across the country. The Hispanic populations as a share of the statewide population. So I do think we haven't done enough to make to drive awareness, to make accessibility a thing across all communities across the country and the Commonwealth. So yes, I think there's a lot of work to be done there in terms of making people aware, making it accessible, making it something that can be easily navigated if maybe, for example, English is not your first language. And so there's work to be done there. I think there's a huge benefit of being a state-based exchange. The state-based marketplace, we are able to tailor our messages and our service and our assistance channels based on the needs of the community across the Commonwealth, where at the federal level, there's, you know, a one-size-fits-all approach for about 35 states, which is just not the same.
And so how would the exchange differ, you know, as a consumer? How is it going to be different from the federal exchange? If I'm right now, somebody taking advantage of that federal program, I'm going to be now migrating, if I understand you correctly, into the Pennsylvania Pennie program.
Right.
Number one, how do I transition? And number two, what can I expect? Is the program going to be similar in terms of the offerings, or is it going to be significantly different? What can I expect as a consumer?
That's great. So this next slide speaks to a lot of that. And it's incumbent or, you know, really the answer to that question drives why the Commonwealth came together last year and decided to make this transition. Pennie came to be through a bipartisan piece of legislation that passed both chambers of the legislature unanimously, which is not a very common thing in my experience, and was signed into law by Governor Wolf last year. And the goal of that legislation was to set up a state-based marketplace and with all of the benefits that come with that, which I'll touch on in a minute, and also to do it at a price point that's much lower than what we'd historically been paying for use of healthcare.gov. The value of doing it for less money is the ability to take those savings and invest it in affordability. So for the same amount of money that Pennsylvania was paying for healthcare.gov, we're getting Pennie, the state-based exchange, and a new affordability program, which will reduce premiums for anyone purchasing health insurance through Pennie. So just in 2021 alone, this new program, this new affordability program, is reducing premiums by 5% next year. But so other benefits that come with this program is, I already touched on this, but the flexibility to serve the different areas of the state. The Philadelphia area is different from Central PA, which is different from the Pittsburgh area. And we can have tailored assistance and outreach and messaging and marketing to reach out to and target people in those different regions. We have local control over our in-person assistance program. This is something that at the federal level has been scaled way back over the last several years. So we're investing a lot more in that. We're actually increasing the size of the resources that we're putting into that program by 3 times. I mentioned the decreased operational costs and ability to keep that money local, reducing premiums through that affordability program, an ability to work with our commercial insurers more closely to foster choice and competition, the ability to work with DHS around the churning population from medical assistance to marketplace and back, and, you know, broadly a customer service approach that is specific to Pennsylvania's needs. Pennsylvanians serving Pennsylvania. And then, you know, just one other thing is the flexibility to create our own policies. And a big one that we've already decided upon is to expand the time period in which people can enroll in coverage. The open enrollment period runs historically from November 1 to December 15th. We decided that's not enough time and have expanded that enrollment period by a month. So this year, open enrollment will run from November 1 through January 15th, which is something we could only do if we had a state-based exchange, state-based marketplace.
And that's very important because, of course, number one, we need to get the word out that the program exists, and this is new for Pennsylvanians. And number two, look, human nature is such, right? in which we tend to really wait until the last minute to do this, which I urge everybody that will be listening and viewing this not to wait until the last minute. So can you tell us a little bit about, so you mentioned that the robust in-person assistance program, what exactly is that? Is that the enrollment assistance or is that something else?
Yeah, they've been commonly known as assisters or navigators. And early on when the ACA was passed, when the marketplace was launched in 2014, it was a very large and robust program of community organizations, health centers, nonprofits who were available to the public to come into their doors and say, I need help accessing coverage, navigating the process. Can you help me? Can you help me walk through this? And those individuals are trained and certified to know the application process and understand what financial, the financial assistance is and how to access it and how to navigate the different plan choices and all of that. So that's a program that was robust early on. It was scaled back significantly 3 years ago, and so in-person assistance across the Commonwealth really, in a lot of ways, went away or dwindled down quite a bit. And purchasing, accessing health coverage is not an easy thing to do. Navigating that process is not easy. It's complicated. In a lot of ways, I think you need a master's degree or a PhD to really understand what a health insurance product is and how to use it, right? So having assistance is key. So that's what we're building up and building back up. So.
I will say that I fully empathize with that statement in that the Hispanic Chamber is a nonprofit, but it's a small business, right? And the least favorite part of my job is at the end of the year, having to manage with the healthcare, programs. And so we know for a fact that many small businesses do not sponsor healthcare programs because it is such a nightmare to do so. Right. So as an employer, it is I fully support a robust in-person assistance program. We know, and we have learned due to the coronavirus, that Latino consumers tend to really appreciate in-person assistance and really having a holding hand, somebody that can really walk you, an expert that can walk our consumers, our residents through the programs, in and outs, and the benefits and how to enroll. So for us, really in the community, it's very important to have that available. So Zach, what would I have to do once I know you're going to walk us through the timeline. So perhaps this is a time to talk about that. But do I, as an employee that is, or somebody that's looking to gain more information or even enroll in the Pennie program, do I go to my healthcare center or to the nonprofit, Congreso? How do I get the information and access the program? And what are the timelines, since it looks like we have them here, so if you can walk us through that.
So starting with the timeline, this is all of this work and effort is leading up to the launch of first the program and then the opening of our doors during open enrollment. So we just launched our customer-facing website, pennie.com, PENNIE.com. That has some basic information on what's coming, key deadlines, when and how you'll be able to access more information and enrollment assistance. That's moving down the path. That's the first step in really launching the program and awareness around it. So in the middle of September, we're going to do a lot more public awareness. And then early October, we're going to start communicating to the existing customer base. So your existing healthcare.gov customers, the 300,000 Pennsylvanians that are to them about what's happening. We're going to move over their information, move over their enrollment opportunities. We're going to communicate directly to them about how they can create about how that information has been transitioned over and how to create an account with us. We will give them the opportunity to automatically renew into their plan if that plan still exists and they are able. And that's all leading up in October to when we will formally open our doors on November 1st for open enrollment. And that's when the application will be available to everyone. That's when really enrollment assisters and producers, agents, brokers across the Commonwealth will be able to assist renewing or new customers from wherever from the uninsured coming in through any other means with the ability to enroll in coverage. So first and foremost, I would say all the information related to that will be available through our website, pennie.com. We also, you can learn more through our call center, which will be stood up and open in early October. So calling in information about where to access in-person assistance. That assister program will be available, and it's in health centers and nonprofits across the Commonwealth, including in the greater Philadelphia area. So that information will be furnished on our website. You can call us. There will be a number of ways to access that as well. So it's not, we are driving public awareness around this in anticipation of when we open our doors. It is not, we're not quite there. We wish we were there. We wish we were open and supporting the Commonwealth currently, but that doesn't fully happen until November 1.
Okay. So, so I think for those that are entrepreneurs, where we know that we are really in a tough economic environment, and you're weighing the options or whether to sponsor a healthcare program in your business or not, these are very critical financial decisions that a business owner must make. The best
Right.
time, I think, those decisions usually, you know, your healthcare provider does not contact you, will contact you probably in November saying, are you going to renew your employees or your program? But it's great that Pennie will be providing information as of October, so that as a business owner, you really can get in touch, really can find out, you really can I would say, investigate what the options are for your employees, so that then you can make a decision on whether your business will be in fact providing or sponsoring healthcare program in your, you know, as part of your benefit package, or due to financial circumstances, if you're not able to do that, then you will be prepared to inform your employees about the alternatives. So there's really no reason why your employees should not have a healthcare product. It just really requires a little bit of due diligence, and knowing that Pennie will be open for, that you guys will be in October, you'll be in a position to really orient businesses. That's really great. So I would encourage people to really, you know, start planning, so that we are not the last minute, having to scramble, finding information and making decisions for our employees. So I have a question. So can you tell us again, you know, eligibility? Can you repeat a little bit of that information in terms of who's eligible for the program, who's eligible for financial assistance?
Yeah, of course. So to be eligible to enroll in a plan through Pennie, you have to be a resident of PA, you need to be lawfully present in the United States, and you have to be, those are the two key main criteria. That's as long as you're lawfully present and a resident of the state, then you should be eligible to enroll in a plan through us. To be eligible to enroll in a plan that has financial assistance, it's largely based on your income, your household income, size of your household, and your income. And so we often internally, because that's, you know, how the sausage is made, we talk about federal poverty level in terms of income. So in a nutshell, is if you're above medical assistance eligibility and below 400% of the federal poverty line, which is roughly $50,000 for an individual, or 100,000-ish, a little over 100,000 for a family of 4, you're going to be eligible for financial assistance through us. The only caveat there is if you don't have access to affordable health coverage somewhere else. So if your employer provides you with an affordable plan, you're actually not eligible for the financial assistance through us. This is primarily intended to be the access point through for people who don't have access to affordable coverage elsewhere. So that's the one caveat. But from an income perspective, it's roughly 12,000 to 49,000 for an individual, and up to about 104,000 for a family of four.
Great. So that's very important information. And of course, all those details will be accessible in the website. So, we have here a very interesting graphic. So why don't you walk us through this? Because for those of us that really care much about, making sure that our communities are fully participating of all the programs, this is an important one.
Yeah, definitely. And this is really helpful for us in understanding where the uninsured are, where they live, and how to allocate and strategically put forward our resources and time and efforts in terms of trying to find and educate the uninsured about what we offer. So what this graph is a overview, a breakdown of the Commonwealth of Pennsylvania based on broken down by counties. The darker the green, the higher the number of uninsured. So Southeast Pennsylvania makes up a big chunk of the uninsured. There are the county with the highest number of uninsured across the Commonwealth is Philadelphia County. And this is 2018 data. I would throw caveat out there that this is prior to the advent of COVID-19, so this doesn't account for any economic impacts of the pandemic, but illustratively, it gives us a good sense of where the uninsured live. So there's still a big remaining concentration of uninsured in the southeast corner of the state. There's a fair amount of uninsured in some pockets of central PA, including Lancaster County. And then in the western part of the state, Allegheny County has about 45,000 uninsured as of 2018.
So I think this is very timely, and having you here at the Greater Philadelphia Hispanic Chamber and providing information about this is incredibly important, because clearly in our communities, we are not accessing the resources at the rate that we would want to. So I think in terms of ensuring that our community is fully protected, ensuring that we have alternatives for our business owners that they can really let their employees know, and we should encourage business owners to let their employees know that there's this resource available to them. So I think, we're sort of coming at the end of our half hour, Resolve It in 30. I want to thank Zach really for being here with us today, and remind, our membership and Latino business owners that while affordability of healthcare is the number one concern for entrepreneurs in our community and really around the country, that the state of Pennsylvania, through the Pennie program, is making healthcare affordability a priority, and really making sure that Latinos can access the program is really high on the list of things to do. We are happy that Zach was here today. We will make sure that our community is fully aware, our members are fully aware that the Pennie program exists. And we know that we will be in full enrollment November 1st through January 15th. So we have some time to plan accordingly. Once again, thank you so much for participating. Zach and Scott, who is in the background here, thank you so much for being with us today.